Well, it is beginning to become somewhat cold here in Texas. So guess what? It's flu season. Or is it? Is it flu? Is it the cold? Or is it COVID? I know one thing that builds up a lot of frustration is we begin to get the little sniffles and we go to the primary care doctor or the urgent care and get told, hey, it's just the cold or it's the flu, you're not getting any antibiotics, it is going to pass in a few days, do the watch and wait. There's a lot of similarities between the three. However, there are subtle differences, and I am here to talk about it. All right, let's go. Okay, before we proceed, this information is from the National Institute of Health. I have a table here which compares the cold, the flu, and COVID in terms of symptomatology. So it goes from the fever to change or loss in taste or smell. So from what we can see, the similarity that exists between all three is a sore throat and a runny or stuffy nose. But then if you go to look at the cold, there's really the only thing that makes it different from the rest of them is the sneezing. So if you have the symptoms and you're sneezing, then yeah, it's probably the cold. If you have the fever, chills, headache, muscle pain, feeling tired and weak, sore throat, a runny nose, sneeze, no sneezing, a cough, shortness of breath, vomiting, diarrhea, a change in taste or smell, then it's COVID. If you have the fever, headaches, the muscle pain, muscle aches, joint aches, feeling tired, a sore throat, a runny nose, still no sneezing, a cough, shortness of breath, difficulty breathing, vomiting, it's probably the flu. Okay, it's probably the flu. And then if you just have a sore throat, a runny nose, sneezing, and a cough, you probably got just the cold, the common cold, what had been existing prior to COVID, coexisted with the flu for many, many years, okay? So then, what is the point of this video? As a parent, as a patient, right, I've had to go to the private, like the urgent care or primary care provider and get told, hey, your child just have a viral infection, or sorry, you just have a cold, and to wait it out. Of course, you feel miserable, right? The stuffiness, the pain, the sinus pain and pressure that exists, you can't really breathe out of your nose, and then you're like sniffling, and there's the post-nasal feel like you're swallowing all the time. It's gonna pass, right? I don't want us as parents to jump on the bandwagon of, oh, I need an antibiotic because I'm feeling bad, because the resistant rates are going up. And for some reason, primary care providers feel a lot of pressure to have to give parents and patients antibiotics, right? But it's not often needed. Granted, if you have been feeling sick for a few days, if you have a known exposure, if you've been around someone that has COVID, then hey, 50-50 chance that it's the COVID. If you've been like at home, isolated, and you're like, well, I haven't really had any exposure that I know of, then it's probably the flu or, you know, some allergies, allergic rhinitis, you know, it's gonna pass, right? If it's the little ones, it's probably like a viral infection. They might have the fever that gets us all like warm and fuzzy. Or my child has a fever, or he has a runny nose, or she's coughing, she's been coughing. It's probably just the cold, right? It's probably just the flu. Go get them tested if they're running a fever. As a parent, you always have the right to be concerned. I just don't want you to get disappointed like, hey, I wasn't given any antibiotic, I wasn't given any steroids. Like for the adults, like we expect to have steroids. We don't always get steroids, right? Because there are other negative connotations, negative things, side effects of the medications that we take, which are not needed, right? Why would you want to take an antibiotic if you have a viral infection and then build the resistance to that antibiotics to where you need it, it doesn't really work for you, right? So we're going to be getting sick. There's going to be a lot of colds. There's going to be a lot of flus, and there's still going to be COVID. Wash your hands like a crazy person. Drink lots of water. Drink lots of water, wipe down surfaces. They said the COVID, it's going to be here. It's going to be like the flu every year. Do your due diligence. Wash your hands again. Stay hydrated. Check in with your primary care provider if you feel like, hey, I'm really not feeling well and right, I'm not really getting better. Get a pulse oximeter. You can get that at Walmart, Walgreens, CVS. Check your pulse ox, check your oxygen saturations, make sure that if you have the cold-like symptoms, the flu-like symptoms, COVID-like symptoms, that you're checking, keeping an eye on your oxygen saturations, because if it drops, we don't want it to drop below a certain number. 92, I like 92. Then again, I'm not a medical doctor, so don't take my word for it. Just keep an eye on it. With the little ones, with the babies, just be extra careful with them. If they're still running the fever, they've been sick for a couple of days, their energy levels have changed, they're not as active as they usually are, they're not really eating, they're